Hi everyone, now today I am starting a very important series related to the important topics of NEET PG. As you all have seen the strike rate of the UPSC CMS important topics, so on your demands I have created the important topics of NEET PG. Today I am starting with the surgery because it has a huge weightage in the NEET PG. What would be my pattern is I would be telling you that how much question that subject carries, and in that subject also what unit carry what what number of questions. So let's start without any further delay. As you all can see on the screen, it's 18 to 21 MCQs out of 200 comes from the surgery portion. Then in that also I have given the unit wise weightage. Highest weightage is of the GIT 4 to 5 questions and minimum weightage is for the hernia and the miscellaneous. Rest you can see on the screen. Now from the GIT these are the ultra important topics. Now what I have done is I have not underlined in this what is the most important topic, because NEET PG exam it doesn't come from only the 10 to 15 topics. At least from the I've already consolidated the list, so that much you have to do. You cannot limit yourself in only the 10-20 topics. You have to do this list at least twice or thrice. You have to become master in these topics, then definitely you can crack your NEET PG exam with a very good rank. Here's the list of the GIT and here is the list of the rest of the topics of the GIT. You can take the screenshot or you can note down this on your page. The next comes about the breast and the thyroid important topics. Next is genitourinary tract. After that there is general. In general, intravenous cannula, you all know you have to they can give you the image of the IV cannula and they can ask you what gauge it is. Then they can give you OT position image. I have to diagnose it is reverse Trendelenburg or Trendelenburg. Then about the knot diagrams, stapler diagrams, cautery diagrams, you have to diagnose it is monophasic or biphasic. You have to do the Ryle's tube, they can ask you the position. So this type of you have to cover these topics. Next is trauma. Trauma is a very important topic. You cannot miss on it. They can give you a clinical case and can ask you for the diagnosis, what tension pneumothorax or open pneumothorax, and burn classification percentage is very important in this, and you can diagnose tension is cardiac tamponade or not. Next is vascular. In vascular you have to do DVT, varicose veins, and that the most important score we all know, CEAP score, you have to do that. Then from the transplant and all, graft rejection, liver and renal transplant, bariatric surgery, cleft lip, these things. From the head and neck surgery you can see the list: ranula, Warthin tumor and malignant melanoma from the hernia, these things. Miscellaneous is very important. Why? Because massive blood transfusion complications, total parenteral nutrition complications, after that post-op fever we have, then lung cancer, then basal cell cancer, Mann syndrome, pheochromocytoma. You cannot miss on at least the miscellaneous list. These are the ultra high yield. From this particular these 4 to 5-6 topics you are going to get 2 to 3 questions. So this list is very important in this. So this is all about the surgery important topics. You can take the screenshot, note down. This is the first series of the surgery, then I would be continuing it with the medicine and the OBG and rest on. So I hope a good response from you all, and you do these topics thoroughly. You do not miss on any on the single topic from this. I know the time has been extended and that is good for you. If you start from now, I should suggest you focus on the important topics only, because if the end you have to do the important topics, then why not start from today? You have a huge amount of time where you can perform well if you haven't started now. You have these topics, go through them thoroughly, and after finishing this, switch on to the next video, which I would be uploading within 1-2 days. Then do, complete those topics and practice grand tests, weekly or bi-weekly. So all the best. Thank you.